Hello, my name is Jason Orcena, Health Commissioner for Union County, just providing another update on our COVID-19 response as a county. First off, as always, our total case count, cumulative case count since the beginning of the pandemic is at 23 confirmed or probable cases. Of those, 19 have recovered and 4 are actively ill and being monitored. Over the last couple of weeks and the last 2 months in total, we've accomplished a number of things as a county. Some of those we've covered in the past, but we wanted to just bring you up to speed on some things we feel very comfortable about their current status and what we've done to accomplish those with our partners. The first and foremost, the last several weeks, obviously, we've spent a lot of time building our contact tracing capacity. Currently within our office, we have 14 contact tracers who can monitor disease outbreaks as they occur and follow up with all contacts of those cases. We've also done a lot of work with Med-Surg. You've heard about that in the past. Certainly it's something that the governor has talked exclusively about extensively over the last several weeks. So that has gone fairly well, and with our partners both in Memorial Hospital and our local EMS and everyone involved in our EOC, we have been able to expand that capability quite significantly. So we're fairly comfortable with where our planning stays at for Med-Surg. The last one we spent a lot of time working on has been our general guidelines on operating safely as we begin this reopening process. We've worked with a number of businesses through it who are deemed essential. How do they have their workers come in and be safe? We're now transitioning into the reopening plan that the governor has outlined, and we're really trying to work with providing some guidance to our businesses in preparation for those reopenings, and now providing interpretations as the orders come out on how they can be compliant with the law and protect their customers and protect their employees as we begin to reopen. So that's been the focus of a lot of our work over the last few months. Things are still progressing. Obviously, everything evolves every day, and so we have to make changes on even our plans that we thought were complete. As we move into this next period during the reopening, there are still some things that are hanging out there we need to continue to focus on. One, obviously, is our graduation ceremonies for our seniors who are graduating from our 3 high schools within the county. And we're working with the superintendents on how to make those a safe ceremony to keep all of our residents, our vulnerable population, and our students safe and still recognize their achievements. The other one we're really focusing a lot of attention on remains the congregate setting, so our assisted living and our nursing homes. Both of those contain vulnerable populations, so we're working very closely with our partners to try to establish mechanism to keep those operations safe and respond quickly if a case of COVID-19 goes into one of those facilities. So that's a snapshot of where we're at currently with our response. This will continue to evolve over the next several weeks as we work our way through the governor's reopening plan. We would encourage all of you, continue to look out for your neighbors and anyone who's a vulnerable population. Continue with the social distancing, continue wearing a mask when you go out if you are able. All of those things will help keep our community safe as we move into this new phase. Thank you.